In this video by Deckplate we will be discussing the condition of thoracolumbar spine, its types, causes, symptoms and diagnosis. The thoracolumbar spine, which connects the thoracic and lumbar vertebrae, is important. It complicates the upper body and allows for a range of movement. These conditions may affect the thoracolumbar spine, with 12 thoracic and 5 lumbar vertebrae. The intervertebral discs and facet joints within this segment permit various movements, including flexion, extension, lateral flexion, and rotation. Thoracolumbar fractures are breakages in the vertebrae of the spinal column in the thoracic and lumbar regions. They may be associated with disruption of the ligamentous complexes and can result in instability or compression of neural structures. Herniated discs. Herniated discs are a frequent problem in the thoracolumbar spine and happen when the disc's soft, gel-like core pushes through a rip in the outer covering. Consequently, nerves may be compressed, causing pain and other unpleasant sensations that the patient may experience. Disc herniations, also known as slipping or ruptured discs, may produce symptoms depending on location and severity. Herniated disc symptoms include pain, numbness and tingling, muscle weakness, changes in reflexes, pain worsened by certain movements, sciatica, bowel or bladder dysfunction, rare. It's important to note that the intensity of herniated disc symptoms may vary greatly, and not everyone will experience them. In addition, some people with a herniated disc may not have any obvious symptoms of this condition. Spinal fractures. Spinal fractures are different than a broken arm or leg. A fracture or dislocation of a vertebra can cause bone fragments to pinch and damage the spinal nerves or spinal cord. Most spinal fractures occur from car accidents, falls, gunshot, or sports. Injuries can range from relatively mild ligament and muscle strains, to fractures and dislocations of the bony vertebrae, to debilitating spinal cord damage. Significant consequences for spinal stability and general function may result from thoracolumbar spine fractures. In addition, traumatic or degenerative disorders like osteoporosis may cause thoracolumbar spine fractures. Spinal integrity may be jeopardized by such breaks. Sacroiliac joint pain is felt in the low back and buttocks. The pain is caused by damage or injury to the joint between the spine and hip. Sacroiliac pain can mimic other conditions, such as a herniated disc or hip problem. Accurate diagnosis is important to determine the source of pain. Physical therapy, stretching exercises, pain medication, and joint injections are used first to manage the symptoms. Surgery to fuse the joint and stop painful motion may be recommended. Lumbosacral strain. Lumbosacral strain is a medical term for an injury that causes low back pain. The lumbosacral area, low back, is between the bottom of the rib cage and the top of the buttocks. A strain is tearing of muscles and tendons. These tears can be very small but still cause pain. How a lumbosacral strain happens. Muscles and tendons connected to the spine can be strained in a number of ways. Sitting or standing in the same position for long periods of time. This can harm the low back over time. Poor posture can make low back pain more likely. Moving the muscles and tendons past their usual range of motion. This can cause a sudden injury. This can happen when you twist, bend over, or lift something heavy. Not using correct technique for sports or tasks like lifting can make back injury more likely. Accidents or falls. Scoliosis. An irregular lateral curve of the spine is an indicator of this condition. Scoliosis occurs when the spine curves abnormally to the side. Although scoliosis may damage the spine at any level, thoracolumbar scoliosis focuses on the chest and lower back. Idiopathic scoliosis, congenital scoliosis, and neuromuscular scoliosis are the three main causes of scoliosis. Risk factors of scoliosis. Genetics, age, gender, and other medical conditions can lead these risk factors in scoliosis. It's important to note that females are more likely than males to need medical intervention for scoliosis. Regular screenings, especially during periods of rapid growth, are essential for identifying scoliosis early on. Segmental instability. Each level of your spine functions as a three-joint complex, 2 facet joints and an intervertebral disc. The 3 complexes function as a tripod to create stability, supporting the weight above each level and during motion. Segmental instability refers to hypermobility or greater than normal range of motion between 2 vertebral motion segments. This condition often develops when a particular disc or facet joint degenerates to the point that it can no longer support the weight of the body through that segment of the spine. Segmental instability of the spine is an abnormal amount of motion, hypermobility, across 2 vertebral body sections. This hypermobility can be when one vertebral body shifts forward, shifts backwards, or sideways, causing an abnormal spinal alignment. Spinal stenosis. This condition causes the spinal canal to become more constricted, which places pressure on the spinal cord and the nerves that exit it. Lower thoracic and upper lumbar spinal stenosis is referred to as thoracolumbar stenosis. Causes includes degenerative change, herniated discs, osteoarthritis, congenital conditions, trauma, tumors and abnormal growths, thickened ligaments. Degenerative disc disease. Degenerative disc disease is when your spinal discs wear down. Spinal discs are rubbery cushions between your vertebrae, bones in your spinal column. They act as shock absorbers and help you move, bend and twist comfortably. Everyone's spinal discs degenerate over time and is a normal part of aging. When the cushions wear away, the bones can start to rub together. This contact can cause pain and other problems, such as adult scoliosis, where the spine curves. Herniated disc, also called a bulged, slipped, or ruptured disc. Spinal stenosis, when the spaces around your spine narrow. Spondylolisthesis, when vertebrae move in and out of place. If you were a discharged veteran from U.S. military and looking for the compensation you can get for the condition of thoracolumbar spine, please check out our other video on thoracolumbar spine with compensation rating. Thank you for watching our video.